Good afternoon, dear colleagues. Nice to meet you. I'm very happy to be a part of such a global event, and for your attention, I would like to present our clinical research, and one of my clinical scientific interest is fatigue, multiple sclerosis, and Watsu. Water plays a crucial role in every person everyday life. The warm water has magical effect, and especially in Watsu therapy it can achieve the muscle relaxation because such temperature matches the natural temperature of the human skin, and near isothermal condition minimizes the thermal stress of the body, thus promoting a state of physiological calm, and the warmth enhances the blood flow to muscles, further assisting relaxation, and the buoyancy of the water also reduces the gravitational load on muscles and joints, this contributing to overall muscle relaxation and pain reduction. And such combination of thermal comfort reduces gravitational stress and enhances circulation, creates an ideal environment for deep muscle relaxation during Watsu sessions. Water for physical and psycho-emotional health additionally brings the favorable and low-risk environment for the physiotherapy sessions and aquatic session, which can reduce the acute injuries consequences, the fear of falling, especially for geriatric patients and for the persons who previously had the episode of drowning in some traumatic events. And after the aquatic body session, every person usually notices that he feels better, not just physically but emotionally too, and all this improves the participation between the physiotherapist and the patient. Of course, it improves the motivation and brings the additional motivation for all rehabilitation team to implement new technique. Of course, the water positively impacts for the persons who has the lack of the confidence, low mood, and low motivation. Aquatic therapy is one of the magical tools to improve the medical treatment, to combine it with the complex rehabilitation. We can implement aquatic rehabilitation for different medical conditions. One of them could be the chronic pain, and including the low back pain and the fibromyalgia. Warm water and the gentle movement will promote muscle relaxation and the pain relief. In different neurological conditions such as the Parkinson's disease, it can improve sleep quality, and in cases of cerebral palsy will improve head control and the limbs movement and the motor abilities. And it can be used in rehabilitation after the stroke, not just hemorrhagic but an ischemic stroke too. Including musculoskeletal condition, it can improve joint mobility, reduce muscle tension, and alleviate pain, which associated such with osteoarthritis, and can also used to improve range of motion and reduce muscle spasm. And it's very important to note that Watsu is widely used for further and high-quality research and to establish the further effectiveness in such mentioned conditions and in much more severe conditions, especially for oncological patients. One of the severe symptoms which usually is mentioned by the patient is fatigue. Fatigue has not just the physical background but has an psycho-emotional part. And aquatic rehabilitation and Watsu, among of them Watsu technique, is very effective by decreasing the fatigue level, the complex fatigue solving. One of our hypotheses by creating Watsu research that aquatic rehabilitation is effective decreasing the symptoms, physical symptoms of neurological or physical disease, and decreasing the severeness of fatigue and spasticity too. Fatigue for multiple sclerosis people is one of the main concern, and by creating the load and creating the method and the techniques for such a patient is very important to think which load can be used. We can use the heavy loads and we can use the quite rapid stretches. So the Watsu therapy it comes to the first place to decrease the fatigue, to decrease the spasticity, to decrease the muscle cramps, severeness, to improve the quality of life. So we came to Watsu. And by going ahead, I will show you the slides later with our results. We achieved the fatigue level decreased in high level. Why Watsu is effective for neurological conditions? It performed in warm water. It very individual. It very relaxive, and such warm water plays a very important role for multiple sclerosis person. What I noticed, yes, multiple sclerosis people feel better in low temperature conditions. In winter, usually they feel better than in summer or in late spring. But for aquatic rehabilitation, it's a bit different. Such warm water gives additional way of support, additional level of psycho-emotional relaxation, and decreases fatigue in high rates. I could add that the Watsu can be implemented for the patient with different condition. Especially it can be implemented for oncological patients too, and for patients with the different level of amputations, of limb amputations, or the body parts amputation. I had a patient after oncological mastectomy. I had the patient for Watsu session after the limb amputation, and I had the patient with the additional walking aids. It's very effective, and I was very nicely surprised that the Watsu as the becomes very universal tool by solving not just the physical but the emotional problem. And I'm very glad that as a physiotherapist, clinical physiotherapist, I can show all the magic of the Watsu and to promote such technique for different patients. And I would like to add that the fatigue also adds the huge negative symptom to the all negative symptoms what multiple sclerosis or different patient can have. It's a depression or anxiety. Watsu can decrease the anxiety and depression and the fear of falling and fear of being into the water in a huge rates. I still can't stop be surprised the Watsu, it's so effective. And the results being into the water can be achieved in quite quickly. As I already mentioned, Watsu can train the brain, it can train the cognitive abilities, it can train the neuroplasticity of the brain, it can train the confidence, motivation. It can be combined for and implementing for different age groups, starting from infants and pregnant women up to the geriatric patient, deeply geriatric patient. It gives the unique sensomotor experience and the very gentle perception and the weightlessness. Sometimes it can be interpreted as the feeling of complete support or compared to returning of the warmth. It can be adapted to every person by using the special floats which are mounted to the body part of the patient. Why even with our eye closed we can achieve the sense of relaxation and the fear and the decrease of fear of falling or movement, of being movement in different part of our everyday life, because water gives additional support and sense of safety. We are floating in a safe, we are moving in a safe place, we are in a safe place, and we can, Watsu being into the water, it gives the additional ability to the person to dream. It decreases spasticity, it decreases fatigue, it decreases pain, physical pain and emotional pain. It improves the motor function for the person. And the passive nature of aquatic rehabilitation allows patient to relax and to receive the treatment, to accept the treatment, to see the technique, and to accept the intervention. Passive technique becomes active and vice versa. It's a combination. And it's very important to include multidisciplinary team in Watsu. It's for physician, it's for physical therapist, it's for occupational therapist, it's for the nurse, it's for the social worker, and of course, it's very important to include the family members, because team plays a crucial role for rehabilitation, for complex rehabilitation. Nevertheless, the technique which will be implemented to individual according to the diagnosis. Indication for Watsu therapy is very different. Different scientific literature brings complex benefits of aquatic therapy, and wide range of resistance makes it suitable for people with all ages. And of course, Watsu can be implemented for mama and the baby, for mama and the child, for the couples, for conflicting persons, for person even with depression and even with suicide thoughts. Among the indications, of course, we have the contraindications. So one of them, if of course it's clinical, it's open wounds, trophic ulcers, it's eczema, it's fungus disease, inflammation of the eyes and ears, perforation of eardrum, severe vestibular disorders, fever, infectious disease, carriage of bacilli, acute internal illness, exacerbation of chronic illness, decompensation of functions, epilepsy, urinary and fecal incontinence, and of course fistulas with purulent discharge and profuse phlegm, and of course the allergy to chlorine and disinfectants. I would like to add that I can't stop be admired of the effectiveness of aquatic therapy, and I'm so happy to meet the Watsu and my teacher Jurga Shvedenia in this life. I met Watsu more than 20 years ago when I was a student in Finland, and first time ever my teacher in Finland applied the Watsu on me in the swimming pool. I didn't know that it was Watsu before I stepped into the water. Until the time I was looking for possibility to find the Watsu and to study. And when it was a possibility in Vilnius, so I met Jurga. Watsu is a magic. It's a pure magic. And I live with multiple sclerosis more than 20 years, and it's not the first research about multiple sclerosis, but I'm so happy that I can implement Watsu and for multiple sclerosis people, because it's very effective tool to decrease not just the physical symptoms, but for such patient is improve their quality of life, to improve their social skills, to decrease pain, to make them smile, to make them feel safe in a very natural way. We implemented the Watsu for 10 weeks, for 10 sessions, once per week. All session took for 60 minutes. Nevertheless, the swimming pool water was maximum for 35 degrees, but 32 degrees was quite normal for them. Usually I do my Watsu sessions in a water temperature of 34-35 degrees, with the floats mounted on the person's legs. As you see, we implemented Watsu Watsu movement, started from the basic movement, and some of them, because of the patient peculiarity and the disease itself and the motor control of the body, we couldn't do all of them, but we adapted very individually the sequence of the movement to our patient. And of course we finished with the head rock completion according to Harald thought movement. Talking about our results, as you see, the level of fatigue decreased in a quite good way and a strong way. After every session, I had the verbal feedback from the person that they feel good, the spasticity level decreased, their mood is good, they feel safe, and could we continue again, and when I can wait for the next session. And when I was asking their feedback and their experience during their week, their life after until next session, it's such a pity that we didn't film them, their shiny eyes, their smiles, their experience, their personal situations, their ability and their new ability to see the problem and how they learning again in a new way to solve the patient and to communicate with other people. And as you see, we have an improvement in the sleep quality. In all group, the level of depression is decreased. Some of the patient even completely removed the depression. And what we can conclude that fatigue decreased, we have the sleep quality and improve the quality of life, improve the severity of physical symptoms is decreased, the spasticity level decreased. One of the patient completely healed from the fear of water, and in her early life, when she was young, she had the aggression and the physical aggression episode. So she cured, and she feels safe, and she feels much more brain. What I can recommend for such a patient, so we believe that our primary study had the significant add to data from the previous scientifical and practical our colleague research all over the world, and such technique is one of the medical tools in aquatic rehabilitation, and it can be implemented for the patient not just with multiple sclerosis, but according with the incurable neurological and oncological diseases too. And I would like to add that our life is meaningless until we live it, and your responsibility to give it person. Thank you.